Dudley is a borough of extremes. On average, men are living nearly 10 years less in Dudley, in the most deprived areas, and women about 8.5 years less. We've got a service called Integrated Plus in Dudley, and they cover the whole region. And I think that actually is a really important model, because instead of having these piecemeal little bits, you've got it working at scale across the borough, and resources can flex and adapt and be shifted around as needed. There's also the link workers in Dudley that work with patients who have much more complex needs. They may be high users of GP services, primary care services, because of the difficulties that they're having. And again, we can refer to that service, and Integrated Plus will allocate where they need to be. And sometimes we do see an almost immediate drop-off in the demand from those patients.
With our high intensity user social prescribing service, we're really targeting people who are presenting at A&E at least 12 times within a 12-month period. So a lot of these people have had a really difficult time, so they may have gone through lots of different services, and for whatever reason it hasn't quite worked for them or helped them move on to kind of meet their goals. We've seen over 50% reduction in admissions at hospital, attendances at A&E, and also reduction in the number of call-outs for West Midlands Ambulance Service. And this has equated into cost savings of around £750,000 each year. So it's a really kind of cost-effective service. It pays for itself.
This model could be replicated across many integrated care systems, and it could be used to bridge some of our challenging gaps and issues with access between primary and secondary care sectors by utilising and enhancing local assets, community services and social prescribing to reduce our waiting lists, demand on our services generated by individuals who do not require medical treatment.
We've got people that we've worked with that literally their lives were in complete chaos, homeless, where after working with us we've managed to get them, a property to live. We've been able to really work with them, get the counselling and the support that they've needed. They've ended up volunteering, and several of the people that we work with are now in fully employed and paid jobs, which is just fantastic to see someone from where they start to see somebody in the community that's now thriving and and working in a paid role. It's fantastic.
When I first met Amy, she was struggling. I spent time with her on a weekly basis. She started to trust me, and then we started looking at her hobbies and her interests. And from there, she just flourished. She built friendships, she went and had a therapy, she went through her recovery, and like you've seen, she is today. She's a completely different person.
I was really mentally unwell and was in and out A&E. Danielle helped me to sort out things like my benefits. She just came somebody that was like a friendly face that would support me and just be honest with me about stuff. It was all making me feel like I had hope in life again. But there's still been like a lot of things along the way that have would have set me back normally, but because I had support, I didn't let it stop me, and so I just kept going. I volunteer as a guide leader at my local guide unit and brownie unit. I play American football and I joined a team at the beginning of this year. I also volunteer here on a Friday, and I volunteer for Integrated Plus as a community buddy.